Palliative Care Summit, sponsored by the National Institute of Nursing Research and partners, health professionals from multiple specialties discussed how to better serve patients in need of end-of-life care and palliative care. Speakers included not only hospitalist and ambulatory care clinicians, but also researchers, nurses, and parents. Dr. Jennifer Temmel conducted a study that showed significant improvements not only in anxiety and depression, but also in survival among patients with advanced lung cancer who received early palliative care. During the summit's closing address, Dr. Randy Curtis, a critical care specialist and researcher, discussed the potential for expanding palliative care research and collaborating among clinicians. Ms. Diane Gray, a parent advocate whose young son died of a rare genetic disease, spoke about the importance of communication between doctors and patients facing end-of-life issues.
It's really very important to know that we are present, we are trying to pay attention, we value your time and we value your input. We truly understand that your time is limited when you're dealing with us as family members and as well trying to take care of our children. With the information that we've just been given, you've taken away our hopes, our dreams, our aspirations, our family structure, as well, everything that we were planning for the next 5 to 10 to 20 years.
Dr. Jennifer Temmel provided perspective on the value of palliative care research.
Traditionally, palliative care has been provided in the inpatient setting, where it has a widespread benefits for patients who are in the hospital. A new area of research is trying to bring palliative care earlier in the course of the disease in patients in the ambulatory care setting. One of the goals of that research is to actually keep medically ill patients out of the hospital, which is usually in line with their preferred goals. So I think moving palliative care to the ambulatory care setting can have significant benefits for patients and their families. We did some work about early palliative care in patients with advanced lung cancer and found that patients receiving early palliative care in the ambulatory care setting had improved quality of life, less depression, and improved quality of care, which may have also translated into a survival benefit. So I think palliative care research is in its infancy, and I think we need to do greater number of studies looking at palliative care, both in the inpatient and in the ambulatory care setting. As an oncologist, I think a big important next step is to try to see if the results that we found in our lung cancer study are generalizable to other cancer populations and in other care settings, for example, in the community.
Finally, Dr. Randy Curtis looked ahead to the future of palliative care.
There have really been a lot of dramatic changes, particularly over the last 10 years or so. Palliative care is much more broadly accepted as an important part of healthcare, both inpatient and outpatient. And there's also a growing realization that end-of-life care is an important component of palliative care, but in fact, palliative care is much broader, that palliative care applies to all patients facing a life-limiting illness or a chronic illness that may shorten their life, whether they're actively dying or in the process of thinking about end-of-life care or not. I think that hospital physicians in particular have a very important role in providing palliative care. We know that many patients die in the hospital or are hospitalized with an acute exacerbation of their chronic illness, opening the opportunity to discuss issues about goals of care and palliative care. I think hospital-based physicians play a very important role in being able to be the ones to introduce that concept. They also may play a very important role by interacting with palliative care teams and even being on palliative care teams. I think there's a growing realization that all physicians caring for patients with life-limiting or life-threatening illness need to have basic palliative care skills, and then there needs to be specialty skills for those who really spend a lot of their time doing this and can be called in for the particularly difficult or complicated cases. This has been an exciting summit. They expected about 500, they had over 1,000. I think this summit really demonstrated that we've made tremendous advances in palliative care, that care has been improved as a result of research, but that there's still a lot of work to be done, that many patients and their families are distressed by the care they receive facing a life-threatening illness or at the end of life, and so we have a lot of room for improvement.